My name is Shirley Lamb, and I'm the Pre-Pharmacy Programming Coordinator. I would like to thank you all for joining us for the 12th Annual UC Davis Pre-Health Professions National Conference. The pharmacy component of this conference started 2 years ago as a mini conference. Today, we present you all with the second full pharmacy conference here at UC Davis. This conference would not have been shaped into what it is today without all of your support, interest, and feedback. Without further ado, can I please have each panelist introduce yourself and the school you are representing, starting with Jennifer.
Hi, my name is Jennifer. I'm representing UCSD San Diego, Skaggs School of Pharmacy and Pharmaceutical Sciences. I am an alumni, so I graduated in 2013.
My turn? Hi, my name is Kimberly Moore. I'm representing the University of Southern California School of Pharmacy, USC, fight on. And I am a current third-year student.
Hi, my name is Dunn. I am a third-year pharmacy student. I'm going to the University of Pacific, and I'm currently doing my APPE rotations in Santa Barbara.
Hi everyone, I'm Justin Rainwater. I'm also a third-year student from UOP, and I'm along with this guy down in Santa Barbara on rotations as well.
Thank you. The first question is, what do you think helped you the most to get you into pharmacy school? Starting with Jennifer.
I think the thing that helped me the most, probably getting experience in a pharmacy. So actually setting foot into a pharmacy, kind of seeing what a pharmacist does, really definitely helped. It gives you something to talk about during an interview, and it shows the interviewer and even the admissions panel that you actually thoughtfully consider pharmacy and why it would be a good fit for you.
For me, I actually worked for a physician in a hospital. I did clinical research, and I think that having any sort of healthcare experience in general is great because the pace of healthcare is very unique. It's different than pretty much any other profession, and the hours are long, and the environment is very high stress. And so having experience where you know what you're getting yourself into, whether it's in a hospital or in a pharmacy, helps you kind of decide that it's actually the right career path for you. And yeah, I think any sort of healthcare experience in general is great just for that.
I mean, yeah, I agree with all the definitely getting experience while you're in school, but also put a lot of time into your applications and your letters of rec. Make sure you get to know some professors or pharmacists that you're close with, so they can actually write a good letter of rec for you. So I think that's pretty important to help you get into pharmacy school.
Pretty much what everyone said. I'm in the consensus with them. One thing also to build upon is your knowledge of pharmacy outside of that. So just staying up on current events and everything, one great thing to really look into is Medscape. You can stay current with all the stuff that's going on in the medical world, not just in pharmacy, but everything in general. That's a great thing to take advantage of. So it prepares you for your interview and have something to talk about just besides your grades, your academics, and all that type of stuff. So just to stay well-rounded with the knowledge and what's going on with current trends in pharmacy.
Thank you. How did you get a letter of rec? Starting with Justin.
Me, letters of rec. Well, I went to Davis. I had a couple from here. I had two. I had my professor, Inoue. I don't know if he still teaches or not. Does he still teach here? Anyone that's from Davis? Yeah? Okay. So I got really close with him, going to office hours and just really building a strong rapport with him and making sure that he knew what I wanted, my goals out of being an undergrad and hopefully, progressing on to pharmacy. So I got really close with him, and he knew my strengths and characteristics, what made me succeed as a student, and I really put time for that. And I also got to know some of the faculty at UOP. I played basketball with them on the weekend, so it was nice to be introduced into that circle and to have, a strong letter of rec coming from inside the school as well.
For me, when I had my pharmacy experience through high school and then a little bit while I was an undergrad at UC Irvine, I got really close with my pharmacist and then kind of just laid out, what I wanted, kind of my goals for pharmacy school. And so that really helped him kind of shape his letter of rec to tailor towards me and not just a generic letter that he may write, many students. So really get to know your professors as well if you're going to get a letter of rec from them, and then make sure they can personalize it so it doesn't just seem like kind of a generic letter of rec and that they kind of send out to other schools. So, yeah.
So what both of they what they both said. And then also, I went to a really small liberal arts college, so I had a unique experience because I was forced to know my faculty really well because I was in a class with a couple other students at most. But yeah, pick people that know you on a deeper level. Don't pick someone just because they have a fancy title. I was actually a history major, and so I had one of my history professors write me a letter because I felt like she knew me on a much deeper level than some of my science professors, and showing that you have kind of a breadth of who you are, I think helps a lot too. So, you don't have to pick the classic organic chemistry professor or the physics professor. Pick someone who really understands you and you feel like they could write a really strong letter. That's my advice.
Definitely what all the other panelists said. For me personally, I was a research assistant, so I got my PI, someone who is in a supervisory position, right one. One of my professors that I took lab with, so they can speak to kind of like a more intimate level and not choose kind of the organic chemistry or general chemistry professors to write it. Because what has happened previously is all they can do out of like, if you were in a class like this with 400 students and you don't know them, all they can write is, they got this grade in your class, and they may or may not get your name right, which has occurred in applications before. So it's really important that you choose a professor that knows you and will get your name right and will actually write something worthwhile than just what grade they got in the class.
The next question is, how did you prepare for interviews? Yes. Yeah.
How did I prepare for interviews? Well, get to know a lot of the pharmacy students that, I'm sure you guys have people that in pharmacy, there's interest there. Talk to them and see what they did. With me, we did a lot of mock interviews. A lot of the people that I was friends with at UC Davis, we're all healthcare professionals now, and what we did is we practiced mock interviews, and we also used Student Doctor Network. That's a website where you can go on, and there's tons of questions pertaining to, or that are tailored to each school, and you can just get questions from them and just practice those. That's probably the best way to prepare for it.
Yeah, definitely agree with Justin. Just mock interviews with your friends, your classmates helps you really prepare when you're in the interview situation. And then really get to know your resume and your CV and your background pretty well, because they can pretty much kind of pinpoint anything and ask you about it. So just make sure you're ready to answer those questions and maybe some difficult questions that you're ready to address.
Definitely. I would practice a lot and definitely know your personal statement, your application, know what you said, because that's something that they do have, and they'll read it and then they'll say, oh, tell us about this experience you had in Mexico. And if you can't talk about it for a minute, don't include it in that, because then it looks kind of phony and superficial, and you want to be able to have a deeper conversation about everything that you put into your application.
So definitely what everyone said, mock interviews are a definitely good way for you to practice. Other things you can do, which I didn't do but found out afterwards was really good, is recording yourself interviewing. You'll see weird mannerism that you do that you never realize, whether you just randomly have a lot of hand gesture. So when you record yourself and watch it, you can see what you're doing, and you can see, that's really annoying. I need to stop that. So that's just really good interview things you could do. Student Doctor Network has a lot of interview questions that school asks. Always know your why pharmacy, why the school, whatever school you're interviewing for. Don't sound well rehearsed, but do know what you're talking about, and don't fumble, but just kind of do research on the school when you do go to interviews, because they will ask you, why do you want to attend the school? And if you don't have an answer, it's just you are just randomly applying to all the schools and hoping to get into one, and it just reflects badly. So be prepared, and definitely know your CV, know your resume, know your personal statement, because as an interviewer for my school, I do pick one interesting sentence that you put in there, and I will ask you to elaborate on it. And for you to not know what it is, reflects badly.
Thank you. What does your typical school day in pharmacy school look like?
That's a good one. Well, right now I'm a third-year student, and at UOP we have an accelerated program. Most pharmacy schools are 4 years. In our case, we accelerate the program into 3 years. So right now I'm on my last year, and that's doing rotations. They call it Advanced Practice Pharmacy Experience. So my day right now, I'm at the oncology clinic in Ventura, and that's an ambulatory care setting. So patients that are able to get their chemo, they come in and we take care of them on that setting. As of right now, so that's my day, usually about 8 hours. And with rotations, it depends on your school that you're going to go to, but you have a couple of different blocks that you get exposed to. So I'm in my second one right now, and that's usually my day will last anywhere from 8 to 4:30. Some of the other people that are in school, they can elaborate on the actual classroom.
Okay, well, since Justin already kind of talked about the rotation aspect, I'll talk about the while in pharmacy school when we were at UOP. So the typical day, usually have class from 8 to 12, and then you get a break for lunch, and then maybe have discussions or labs in the afternoon. And also, if you have free time in the afternoon, then that's when we do our IPPE rotations to get some intern hours as well through various different pharmacies around the area. So, I mean, that was pretty much typical day, and then we had a block week of midterms and block week of finals in each semester. So, yeah.
So I'm in my third year at USC, and we don't do an accelerated program. We're 4 years. So third year is typically the most rigorous year. So our schedule is therapeutic modules. So I just last week completed the cardiology module. So we spent 6.5 weeks pretty much every day, all day in cardiology, learning the different disease states, the different pharmacology for the different drugs. And now I'm in endocrine. But my days pretty much consist of class 8, maybe 9, if they're feeling generous, till 12, and then 1 to 3 or 4. Some days of the week I go to work afterwards. Some days of the week I study with my study partner. And on Fridays, we don't have class, and we are either on rotation at an ambulatory care clinic, so kind of like what Justin's doing, or I go to work, and I work, I actually work at the pharmacy on USC's University Park campus, which is separate from the health sciences campus. So I'm there from 9 to 6 on Fridays. So, and then on weekends, I sometimes work. But yeah, it's pretty much you're in school all day, and then you study.
So at UCSD, it's pretty much similar. You are in school. How it's set up at UCSD is a little bit different. It's a 4-year program. We are a quarter system except for your second year, which is a block system. So you're learning biochemistry, and then like cardiovascular, and then pulmonary, immunology, and that is taken with the School of Medicine. So that's why it's set up in a block system. Your first and your third year is a quarter system. Your first year, you're focusing on pharmacy practice. Most of your classes are in the morning, with maybe some classes in the afternoon, a lot of conferences in the afternoon, and you have IPPE hours that you need to do. Third year is your therapeutics lecture, so that's where you learn most of your pharmacology. A lot of the drugs are all learned in the third year. And so classes are in the morning, and then you can have conference in the afternoon. For some students, they worked as well, so they worked either on weekends or weeknights, and so they'll work 1 day a week, sometimes 2 days a week, depending on what they can spare. And some of my classmates worked a lot, some didn't, so it really depends on you. And the fourth year for us is APPE, as the other students have talked about. We have 7 different rotations that you do choose, so 2 in ambulatory care clinics, 2 acute care are required. You do have a hospital practice and a community, and you do have electives that you can choose from. And those days really varies in your fourth year depending on what rotation you're on. If you're on acute care and your team rounds at 6, you're there at 5 a.m. in the morning. So that's how it is. Am care is a little bit easier because clinics are only open from 8 to 5, so you only have to be there 8 to 5. So it's very different depending on what you're doing for which specific year and what clinic or what rotation you're on for your fourth year. So it's very varying.
Thank you. Do you have any advice for students who do not get into pharmacy school?
Don't get into pharmacy school. Well, if you still want to go to school, I mean, there's definitely things you can improve on. One of the things that you can do right away is if you don't get in, if you get, the denial letter and don't get an interview, you can call the admissions office and ask them, what were my weaknesses, and they'll take time to explain that to you. So if you take a year off and better yourself as far as taking other classes, increasing your science GPA, doing something in a pharmacy or medical setting, that'll definitely improve your chances to getting in next year. So I would just recommend contacting them and seeing what your weaknesses are, and then maybe if you know them yourself, you can definitely improve on that.
Yeah, definitely if you don't get into pharmacy school this year or whatever year you're applying, try not to get down. I mean, it happens to people, some people. Try to probably gets more experience or more experience in the pharmacy or in kind of research related. But if you do get an interview the next year, then it can kind of show you how motivated you are. Maybe didn't get accepted the first time, but I really want to do pharmacy, and then it can be a good talking point during your interview when you eventually do get interviews.
I agree. I think if you don't get in, you should keep trying, because I think pharmacy is a great profession. And yeah, more experience, immerse yourself in something, go on mission trips, try and volunteer in a hospital, volunteer in a pharmacy. I think just showing that you're persevering says a lot about your maturity and a lot about the type of person you are. So I don't think that you should look at it as a failure. Look at it as an opportunity to really show your character and then translate that into your application for the next year.
I definitely agree with everything that was stated. If pharmacy is something you really want to do, don't give up on it. Keep trying. I think our school had someone that applied 3 times. Mm-hmm. They got in. So 3 times the charm. We have reapplicants at our school, so you can get in as a reapplicant even to the same school. So it's not something to get discouraged about. If pharmacy is really what you want to do, keep pursuing it. So get the experience, just make your CV better, your resume better, so it's just staying involved in something.
What was your most memorable experience with a patient thus far?
Okay, so I'm on rotations right now, and my first rotation was actually internal medicine, so rounding with the actual interdisciplinary team and going to patient's room, working up the cases, making our recommendations. It was my second week on rotations. I haven't really gone on rounds yet with the doctors and the rest of the pharmacy team, and we were soaping up a patient, and this patient had diabetes, and the reason he was in the hospital is because of a foot infection. Not sure if you guys know too much about the disease state, but one of the biggest symptoms of diabetes is neuropathy in this case. So some of the microvascular complications. And in this case, patients are prone to foot infections. So this patient had a really bad foot infection. And we went to see the patient. We thought he came back from surgery with just, a regular cleaning out the wound and, closing him back up. When we got there, the nurse pulled off the cover and his actual above-the-knee amputation happened, and we weren't expecting that at all. We thought, it was just a wound. But when we came in, we saw that, and this is only my second week, so it's just kind of interesting to see, an amputation just right there in the flesh. It looked like a movie, and this is my first time ever experiencing anything like that, so I thought it was something memorable at least. But there's some other great stories, too. If you guys want to talk to me after that, I can give you some more memorable things where I've actually helped patients out, so.
Yeah, definitely tons and tons of patient stories, good and bad. So one of my most memorable ones was actually my first IPPE rotation. It was in my second semester of pharmacy school, and then it was actually my first consultation as an intern pharmacist. And so my preceptor, he gave me an antibiotic to look over. He's like, make sure you know what to say and things. So I was getting ready, I was feeling kind of nervous, and then once the patient picked up their medication, the tech told me, oh, the patient doesn't want a consultation. So I was like, oh, okay, never mind. And then afterwards, once the patient knew that I was a student and it was going to be my first consultation, she was actually really nice. She's like, oh, okay, I'll just get the consultation anyways. So I gave my consultation. I was kind of nervous, but it actually went pretty well, and she didn't really need the consultation at all. So that was really nice of her to allow me to get that experience, and after that, got a lot better at consultations. So that was pretty memorable.
Oh, there's always a lot of patient stories. But actually, last week, maybe the week before, I was in one of our safety net clinics. So safety nets are clinics for the underserved. In USC, we're in this really cool location in LA where everybody's underserved and needs as much care as possible. And so we have a really extensive safety net clinic network that we work with, and I was at the clinic, and they're like, okay, so we're going to go in and you're going to see this patient, and he has acromegaly, which is this hormone disorder, so their hands are ginormous. Like, they look like just huge. I've never seen hands so large, and their jaws are really pronounced, and I didn't really realize that it's super rare to see someone who has acromegaly, because I was just telling the faculty member I'm here with that I saw this patient. She goes, "You've seen acromegaly? I've never seen that." And I was like, oh my gosh, okay, cool. Okay, so, but this patient, he had diabetes, and his diabetes wasn't well controlled because his hands were so big that he couldn't inject himself with insulin. And so he's had all of these complications, and his sight's bad from the complications of the diabetes. So they finally send him to pharmacy, where our job is basically to figure out how we're going to get insulin in this guy without him using his hands. And I know, it's just a very typical pharmacy job. Like, please make a miracle happen. We can't figure out how to, anyways. So he didn't like quick pens, which are the pens you just take it off and you jab, basically, because he didn't think they worked because he didn't use them right the first time. So he didn't want to use those. He wanted us to get a vial. He needed a vial and somehow draw up the syringe and then inject himself when he had very little dexterity. And so we had to pre-fill all of his syringes and then send him home with them. And we had to schedule his insulin when his wife or his son were at home. And so it was this really long, complicated process. And it was so neat because you see where pharmacists can really make a difference. Here's a guy whose blood sugars were 400, 500 all the time. And just so you know, anything over 200 is really bad. And he was just so thankful that we were willing to take that time. And you just saw this, okay, this is someone who wants so badly to be better. And so that was kind of a really fun patient case I had the other day, and it was unique, so yeah.
That's hard to follow up on. So I think the most memorable patient interaction I had was partly in the tobacco cessation clinic that I had at the VA. And what was really most memorable about this was that I was talking to this patient. It's a phone clinic, so I was talking on a patient on the phone, talking to her about setting a quit date, and we set up a quit date already, and this was my follow-up phone call with her. And so when I called her, I was like, "Oh, well, how did you quit? How is it going?" She started bawling on me, crying, and just I didn't quit. I really want to quit, and it was just trying to be there for the patient, and just for, my preceptor actually makes fun of me for this, because I think I told her, if you don't give up, we won't give up on you if you don't give up on yourself, kind of in a way. And so that was kind of really motivational for her, and that she's like, yeah, I won't give up. I need to do this. I need to do it for my kids. I need to quit. I cut down on smoking, but I just haven't been able to stop. So it was something that just, whenever I call her, she always remembers me. And when I had to tell her that I was leaving the rotation, she was like, "No, you can't leave me. You can't leave me. You need to call me." And it was hard for me to leave the rotation too, because I was like, I want to keep talking to you and making sure you follow through on this. So I think that was one of the best interactions I had, even though I never saw her face to face. It was something that just gave her motivation and just kind of gave her a reason to keep on pursuing that you could quit. It doesn't matter if you kind of relapse. It doesn't matter if you kind of just take smoke, just as long as you keep going towards your goal. So perseverance. So that was.
Thank you all for sharing. The next question is, how do you balance your life outside of school? What do you do to de-stress?
That's a great question. That's something that everyone should really, really focus on, and knowing what you're going to get into once you get into pharmacy school. Mental health is something that I'm very passionate in. I'm the co-chair for that, and it's a new level of stress. If you thought you've ever experienced stress, once you get into pharmacy school, it's magnitudes of order times more intense. So spacing out your schedule and making sure that you have some me time for things that you like to enjoy, whether it's riding your bike, playing sports, listening to music, hanging out with friends. Make sure you budget that into your daily schedule to give yourself that break, because without it, everything's just going to build up, and then you're going to collapse. You have to have free time to really sit down and make sure and de-stress and everything. That way you have to continue with it. That's what I'm trying to get at right now. It's just, if you let yourself build up, you're going to have a horrible time, and you really have to have fun and make sure that you set yourself some time so you can really so you can really make it through the whole program. So the way I de-stressed was just listening to music, hanging out with friends, going to shows, riding my bike, playing sports, doing all those type of things. So make sure you still have some time in your, your weekly schedule just to do that type of stuff.
Yeah, definitely. It's all about balance. I mean, even while you're in undergrad, you guys balance, social and then academic life. It's same with pharmacy school. You definitely want to have that balance. Obviously, it's a little more challenging on the academic side, but you want to schedule time. Schedule time for you. So schedule time that you do things that you enjoy. Take advantage of the weekends if you don't have things to study for. Or you don't have to spend the whole day studying. Go on trips, go out of town. So do different kinds of things, even during the weekdays. If you enjoy working out, playing sports, just something to get your mind off of pharmacy. Because if your mind's just 100% on pharmacy and you're just studying all the time, then you're going to get burnt out very quick. And then I've seen some people do that. So definitely have some me time.
I think when you're in grad school, you feel like you always should be doing something for school. And so there's always this lingering, I could be studying for that exam. I should maybe start that SOAP note I'm supposed to do. There's always something to do. And you have to figure out a good way to just be able to say, okay, I'm going to do what I need to do for this much time, and then I'm going to move on. And I have a friend who has a treat yourself board, and every exam, she has a treat yourself. And so she goes and she does something on her treat yourself. And it's so funny because she's like, it's my treat yourself. And it's like her favorite phrase, as I've said 4 times. And so sometimes we go to Disneyland after exams because it's happy. And you're like, I should be studying for my exam, but I'm at Disneyland. And it's just so happy. And I have to book myself gym classes a week in advance where I can't cancel it because then I have to go. And you just have to kind of motivate yourself to do something outside of school because everyone around you is studying all the time. And you're just like, I should be studying. They're all studying. Oh my gosh, what's wrong with me? But mental health, you will not survive pharmacy school if you can't find something that just helps you to de-stress. And it really helps to have a good group of friends, which everyone finds their friends in pharmacy school, that is kind of, you guys plan things together because you're in it together, and then we go to ballets or we go to shows, and you have to find that rhythm of when to just turn it off for even an hour or half an hour. Just turn off school and say, I'm going to go do something that has nothing to do with healthcare, nothing to do with pharmacology. I don't want to hear about it. And yeah, it's hard, but it's worth it, I promise.
So for me, in particular, how I survived pharmacy school was my friends. So my classmate, I had a really good support system. So our class is a class of 60, so we got to know our classmates really well. And what really helped me was after each exam, me and one of my classmates, no matter what, we go out for what we call pho dates. And we go eat pho. And it was great because we both love pho, so we just go and eat. Sometimes we eat other things, but pho dates were our dates that we go on, and it was just me and my friend de-stressing, eating a nice bowl of pho. It didn't have to be great because we went to the closest one near school, and it wasn't awesome, but we still went because that was our thing to do. Other things, me and my other friend, we would go get boba, so we will just take a walk from our campus, our building that we have, and we will walk over to kind of what's here to MU. We will go over to the Price Center and we will get boba, which is, we have a Tap X on campus. So we'll get milk tea and we'll get boba, and that's just something that's well, I'm tired of studying. Well, let's go get something to eat or drink, or just something to just do something else just for a little bit, and then get some fresh air and you're back to studying if needed. So friends, the friends you make are kind of what supports you through everything.
If you could go back in time when you were working on your application, what advice would you give yourself?
Don't procrastinate. That's one thing. I applied early, but I still waited till last minute for Tier 1 deadline. And I scheduled a trip for Vegas. So I had about a week to finalize everything, but I shouldn't tell you guys that. But anyways, just procrastinate and make sure that you manage your time, because if you're scrambling for a letter of rec and you give your professor a week to write it, what's the quality going to be like? Can they really get that in depth and really capture everything that you're good at if you tell them right away? So don't do that. Just give yourself time, start early, and just set aside 30 to 45 minutes every day, making sure your application is really dialed in. So just space it out.
Yeah, definitely think about how much time you need to do your PharmCast or your supplemental applications, and just about like double that, because things will come up and you'll figure out new stuff to add in and things to talk about. So yeah, definitely don't procrastinate. It can build up on you, and then you're really stressed out at the end, and then your application doesn't look as good as it could have been. And then also, yeah, with the letter of recs, make sure you don't give your professors or your pharmacists notice last minute, oh, you have a week to give it, to write my letter of rec if you could, and then they're just scrambling to write it for you, and it's not as good. So definitely plan ahead. Make sure you have a good plan for applying.
Definitely start early. I know at least at USC we do rolling applications, so the earlier you get it in, the better, because when the class gets filled up, it gets filled up. Not to say that if you turned it in November, you couldn't get it in, but it's better the earlier you start. And then like I was saying about the interviews, with your personal statement, make sure it really reflects who you are. Be yourself. If you're really good at art, that's cool, and you should be able, that's an interesting thing that probably not a lot of pharmacy students include. So include just who you are. It doesn't have to be, I'm so good at all of these very scientific and mathematical things. If you have other skills, that's great. And I think that is something that makes you a complete person. And as a pharmacist, you want to be a complete person. So and make your application really reflect who you are, even if you feel like it's not exactly what you think they'd want to hear. It might be exactly what the admissions committee wants to see. So that's my advice.
If I had to apply to pharmacy school all over again, what would I tell myself? I think what I would tell myself is get out of the California bubble. Though I love the school that I went to, but I think exploring other options outside of California, researching other schools as well, because there are so many great schools outside of California that it's worthwhile to actually explore other options. And it's 4 years of your life. You can go out, explore other states, come back, and still be fine. It's amazing what's out there. So I think exploring other options out there besides staying in this nice California little bubble.
Thank you. So there's about 10 more minutes in this workshop, so I'll open up to the floor to ask questions. Do you guys have any questions?
Any take?
Okay.
There.
Yeah, he has one.
It was just one bowl of pho, and depending on, sometimes my friend would actually get an extra large pho, and now it's like, that's a good idea. I'll get an extra large pho, and I'll have leftovers, so I can have some the next day. So I didn't go out for that much pho.
Right there. Why I chose pharmacy and when did I realize that? Well, I had a lot of family friends. None of my parents are pharmacists, but I was exposed to a lot of pharmacists early on. About 18 or so is when I started realizing this. And the way it worked for me is I volunteered in a community pharmacy, and I saw what an exemplary pharmacist he was and what he really did for the community and the knowledge and how much he really wanted to help as far as, in pharmacy, and not on the aspect, but just in general through his medical knowledge. So I saw that, and he was my role model, and I just knew right then and there that I could see myself doing that. So early on, I decided I wanted to be a pharmacist. It might be a little different for everyone else. I'll let them elaborate on that.
Yeah, I mean, I had a lot of family friends, brothers, uncles, aunts, family friends that were in pharmacy, and so I kind of had that exposure early on, working in pharmacy in high school, actually. So definitely getting experience in an actual pharmacy, so you actually know what you're getting yourself into before you before you jump into this ship. So. But it wasn't until actually end of my first year of undergrad that I really decided, I really want to apply to pharmacy school and everything. So I mean, I was taking all the science classes, I was still getting all the prereqs done, but then I officially, after my first year, definitely, that's when I wanted to apply.
I actually grew up with a pharmacist. My mom was a pharmacist, and so I was around healthcare my whole life. And I always knew I wanted to go into healthcare, but I wasn't really sure what kind of healthcare. So I ended up working for this physician, and I liked aspects of what she did, but mostly I liked all of the drug stuff. And so I thought I would go to clinic with her, and I would see patients, and I would be like, oh my gosh, I don't want to touch them. Oh my gosh, I can't believe that, all of these things. And then when we would go and I'd sit at Journal Club, which is basically you go over an article that's been published, and it talks about, this design, the study design. And anytime it was about drugs, I really liked it. And anytime it was about anything else, I was like, I'm not paying attention. And so that's when I was like, wow, I think I like pharmacy. And so, that's how I ended up in pharmacy.
When did I realize I wanted to be a pharmacist? That's a really good question. So my mom wanted me to be a pharmacist. I delayed her and just said, I'm going to go do 4 years of undergrad instead of going straight to UOP and commit to the pre-pharmacy program. I'm going to go explore my options because there's so many things I could be. So I did that. I came here to Davis, and pharmacology in one of the classes really got me hooked. And I was just like, I like this. I like pharmacology. So I went and explored and kind of did an internship through I don't even remember what it's called here, but one of the health internships through UC Davis and in a pharmacy. And I was like, okay, I can see myself doing this. I like the patient interaction. I like helping people. But I think the moment that really came, unfortunately, was partly in pharmacy school in my 4th year when I realized what type of pharmacist I wanted to be. So that's 4th year is when you get most of your experience, when you go through APPE, and that's when you really decide, this is the type of pharmacist I want to be. So you could decide you want to be a pharmacist, but what type of pharmacist that you end up being is really going to be up in the air. Keep your options open, explore every single little thing that you can find about pharmacy and the field of pharmacy. And if you find something you do like, go for it.
Right after you graduated? Well,
You graduate undergrad or pharmacy school? Oh, that's for her.
I'll answer that.
I haven't graduated yet. Not there.
So right after you graduate pharmacy school, there are many different paths you can actually take. So what I did personally was I did a residency. So I did a PGY1 in general pharmacy practice at VA San Francisco. So that's one of the options you could do is a residency. And then there are PGY2s as well if you want to go further into a specialty such as HEMONC, critical care, pediatrics. Other things you could do if you're interested is fellowships, which is kind of more in the pharmaceutical industry. So if that's something you want to do, I know Rutgers has a great program, and that's with different schools of pharmacy that you can actually get pharmaceutical industry experience. UCSD teams with Pfizer for like a HEMONC pharmacokinetics fellowship that you could do. And the other option you can take is you can go into the workforce. You could either not get licensed or get licensed because you have a PharmD, and if you're not going to practice, you can still do other things as well in the pharmaceutical industry, in research, clinical trials, or you could get licensed and work in a pharmacy, whether that's hospital pharmacy, retail pharmacy, or some other type of pharmacy. There's many different options you could take, so explore.
Yeah.
What did you guys do to stand out before applying? Did you volunteer a specific thing? What do you think helped you in?
I think that being able to explain. So I worked in county hospital at USC or LAC USC, and I worked in family planning, which is kind of an interesting, controversial area. And I think one way to make yourself stand out is you have an experience, and you can explain your experience, and that's great. But being able to explain your experience and then go further and examine how that really developed you and matured you, I think is something that oftentimes people don't kind of take that next step. And I think that's a really good way to differentiate yourself. Does anyone else have any other opinions?
I think for me personally, when I look at applicants, a well-rounded applicant, that you're not just a great student with a 4.0, but you have no extracurricular activities, you can't communicate, which isn't great. So we want someone that is great academically, doesn't need to be a 4.0, but have extracurricular activities, have experience, world experience, like life experience in something, and have just a well-rounded application instead of an applicant that's really only strong in one thing. And just being able to communicate, because a pharmacist is always on the front line of healthcare. We're talking to patients a lot, and if you're not able to communicate, then you can't teach the patient what to do, communicate to them how they're supposed to take a medication. So communication skills is very important.
Yeah, definitely, just with the experience. And then during your interview and your application, show something you're passionate about. Because if you're just volunteering for all these things and getting all this experience, but you kind of don't really have like a good reason why you did those, or you weren't interested in them, then they can kind of tell you're just trying to pack your CV with a bunch of things. But if you really narrow it down and then show them that you were really passionate about this, and then they can see that, and then I think that would really help with the application and the interview as well.
Yeah, definitely I agree with what everything's been said today. I was really more of a well-balanced candidate. I wouldn't say I really stood out. I didn't have the 4.0. I wasn't just, I didn't come from a pharmacy family. I didn't really have that strong connection. But what made me a decent candidate was that I really was very passionate about pharmacy. I started off wanting to do community pharmacy, but as you go through the program, you really decide what you want to do later on. And right now, I'm kind of torn between going from a community pharmacy and doing inpatient pharmacy. But what everyone else has said right now is just to make sure that you have a lot of experience in everything that's going on. So with what I did is I took a class on addictive drugs here at Davis. And that's what really got me into pharmacy. It was basically drugs, but, street drugs. And it's the same exact thing, the way it's delivered, the way it gets in your body, what it does. So that's what really excited me, and that's what I really elaborated on in my interview. And it kind of went hand in hand with pharmacy, but on the illegal side of things. So that was kind of what made me kind of stand out, but then again, you can apply it to pharmacy. So if you know your story and you know where you're going with it, that's a good thing to do.
I can start. I love USC. No, I chose USC, so we're on a major medical campus. So we are basically in the middle of LA County Hospital, Keck Hospital of USC, and Norris Hospital. We are on a graduate-only, programs-only campus, so it feels like you're in a workplace, not so much like you're in school, it has this very, what you're doing is important kind of, sorry, I get so excited. I have this, it feels like what you're doing so important and so big. And USC also has this big Trojan family community that's so, it's like interwoven through everything that you do. We own 3 pharmacies. The School of Pharmacy owns 3 pharmacies. 2 of those pharmacies are on the UPC campus, which is what most people would call the main campus, and one's at Keck Hospital. And so there's just this sense of you're part of something really big. And we give so much back to the community because we're in an underserved area, so we have these safety nets, and there's research in on every floor, and you're walking around and you're next to patients in the cafeteria line, and then your dean standing behind you, and then the dean of the medical schools behind him. And it's the sense of community at USC is really, I think, unique. And yeah, I love USC, I guess, yeah.
So why I chose UC San Diego? To tell you the truth, the main playing factor was cost, tuition. Versus a private school, public school are cheaper, but cost is going up, so I don't know how big of a factor that plays. Other things was kind of standard of living, lifestyle living. I hate LA traffic, don't want to move there. Didn't really like Stockton either, sorry. I'm originally from Sacramento, so I know what Stockton is like. San Diego, beautiful, what's not to love? But overall, what UCSD can offer, And I think this is what you need to decide when you choose a school is your fit, which school you fit most in. It doesn't matter how the school is ranked or what it can offer you, but how well you fit into that school. So will you be happy there? That is a very important question, because if you're not going to be happy there, it's going to be the most miserable years of your life. So choose a school that is a great fit for you, that will make you happy. But UCSD in general, it's a public school. The tuition was cheaper. We're in a UC. I wanted to stay within a UC campus. There are a lot of resources within a UC. We have a UCSD Medical Center that is linked with our school, so there are great rotation sites. Our class size, which is 60, which I really loved. And we are a pass-fail school, so what's not to love about just passing instead of fighting every single time for a grade? And I really like the philosophy that was at UCSD with this collaboration with the School of Medicine, taking classes with them, working with them side by side in free clinic and on rotations and classes. So it was just overall fit. UCSD was kind of, looking back on it, a really great fit for me personally.
So for me, my brother went to UOP. I have a few uncles that went to UOP, so I guess you could say I'm a legacy. I mean, I've gotten to know many UOP alumni, pharmacy alumni throughout the years, and then just to see that connection they have with the school. It's not they just graduate, have they get their degree, start working, and then and that's it. So they really like coming back, talking to the students, getting to know the students, and just seeing that whole Pacific family and how close-knit they were, which is something that really drew me to UOP. And then also going off of what Jennifer said, just making sure that you do go to the school that you think that is the right fit for you, and not the school that, you know, maybe, I don't know, what other reasons, but definitely find something that you can see yourself being there for the next 3 or 4 years, and that you can study hard at, and have fun as well.
Just to elaborate on what Jared said, the network at UOP is just so extensive. If you look up and down California, about all pharmacists that are practicing in California, 70% of them are UOP graduates. And it's great to go to different conferences throughout through the state and just meet people from UOP, you know, and they're very involved in what we do. I mean, I've met as much pharmacists and alumni and faculty members from UOP than we have as classmates. And it's great to go to these conferences and really connect with them, and everyone's really passionate about pharmacy. So that's one thing, just the network, and then also for me, the location. I'm not from Stockton, but I'm from Antioch. It's in the Bay Area. So it was really close, and I enjoy going back home, hanging out with friends, seeing my brother and stuff like that. So there's a multitude of things. Just make sure that you're a good fit for the school.
As we come to an end of this panel, I would like to thank our panelists for sharing your experiences, and thank you all for coming.